While only a minor percentage of children contracted COVID-19, tens of thousands are suffering as collateral damage. Child hunger has rapidly increased as unemployment escalated. 1 in 7 households reported that children went to bed hungry during April 2021. UCT's Children's Institute says children must be placed at the heart of the response and recovery plans of the COVID-19 pandemic.
We need to protect, maintain and restore children's services so that they are able to access the support that they need. This includes education, early childhood development programs, healthcare services and child protection services.
On a physical level, child services have been on the decline as the adult population battles the unprecedented health crisis. This as measures are imposed to curb the spread of the infections.
Of equal concern is the disruption in routine health services, with primary healthcare visits for children under 5 decreasing by 23% from 2019 to 2020, leading to significant gaps in the testing and treatment of HIV, TB and malnutrition.
In the same vein, there is great concern over the mental health and well-being of all children. Death, loss and anxiety have become commonplace as a result of the pandemic. It's estimated that over 1 million children globally have lost a primary caregiver because of COVID-19 between March 2020 and April 2021.
We also have to talk about the grief that is pervasive for both children and their caregivers. So both children and families need emotional support and opportunities to help process their grief and loss. And I think we have yet to see the direct impact that this grief and this uniform loss has on the mental health of our children growing forward.
The immense impact of losing a loved one is just one of the major challenges. Children might experience the same anxiety as adults, but it could manifest differently than expected. Primary caregivers and community involvement can play a major role in identifying and assisting children that experience possible mental health challenges.
But we can also ask for there to be predictable, reliable routines which will help contain children. We have to create a space for children where they're able to express their emotions, and we have to express the need for more resources in terms of healthcare support for the adults in relationships with these children, because children don't exist on their own but are essentially part of a relationship. There certainly aren't enough resources available for children to access care, and we need to strengthen our non-mainstream ideas of providing care. So for example, strengthening the school system, the education support, primary healthcare workers.
Experts say children are the most vulnerable in terms of mental health consequences, and focused care on the well-being of children is now crucial more than ever. Mariska Botha, SABC News, Cape Town.